We're focusing on communication with anxious patients, a critical skill for the phlebotomy exam. Exam questions on this topic won't just ask for definitions. They will present you with a scenario and ask for the best action. Your ability to choose the most therapeutic and effective response is what's being tested. A common scenario involves a patient who verbally expresses fear of needles. The wrong answer choice is always one that dismisses their fear, like saying, "Oh, don't worry, it's a simple procedure." The correct answer involves acknowledging and validating their feelings. For example, a high-scoring response would be, "I understand that having blood drawn can be nerve-wracking for many people. We can take this at your pace." This builds trust and rapport, which is a key principle in patient care. Another way this is tested is through your explanation of the procedure. The exam will give you options, and you must choose the one that uses simple, clear language, avoiding medical jargon. Instead of saying, "I am going to perform a venipuncture on the antecubital fossa," the better, patient-centered explanation is, "I'm going to find a good vein in your arm, clean the area, and then you'll feel a small pinch as I collect the sample." This clarity reduces fear of the unknown. The exam also expects you to use active coping strategies. You might see a question where a patient is highly anxious, and the options include starting the draw quickly, telling them to hold still, or guiding them through a coping mechanism. The best answer is to actively help them cope. You could say, "Let's try a breathing exercise. Take a slow, deep breath in, and now out. While I get ready, could you tell me about your plans for the rest of the day?" This combines breathing with a distraction technique, both proven methods to reduce anxiety. A major exam trap is the phrase, "This will not hurt." Never choose this answer. It is dishonest and breaks the trust you've just built. The correct phrasing is always something like, "You will feel a small pinch," or "You might feel a quick poke." Honesty is critical. For pediatric patients, the exam will test your knowledge of age-appropriate communication and family involvement. The best action often involves coaching the parent to help comfort the child and giving the child a sense of control where possible. For instance, asking, "Would you like to count to 3 with me before the poke, or should I just be quick?" gives them a choice. Finally, these techniques are all part of a larger concept called trauma-informed care. While the exam might not use that specific term, the principles are tested. It's about creating a safe environment, giving the patient choices, and building trust. Your calm, confident tone is just as important as your words. A great mnemonic to remember is ACE. Acknowledge their feelings, clearly explain the procedure, and engage them in distraction. Use ACE to navigate these tricky scenario questions. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.